So good day, sir. I am Farla Asabio from BSN 4, 14B, and for today I will be reciting the 12 cranial nerves. So first cranial nerve is the olfactory. So its nerve type is sensory. So for the function, it carries smell impulses from nasal mucous membrane to brain. For its implication, so when a nerve can't function well, there's a decrease in ability to smell or changes in the way they perceive odors such as anosmia, hyposomia, and hyperosmia. So one of the disorder in this cranial nerves is anosmia, which is the loss of smell or inability to smell. So next is the second cranial nerve or the optic nerve. So its nerve type is sensory. For the function, it carries visual impulses from eye to brain. So for the implication, the damages to an optic nerve can cause loss of vision. It may affect one or both eyes. So one of the disorder in this cranial nerve is the optic neuritis. So it is a condition which results from inflammation that damages the optic nerve. So next is the third cranial nerve. So the third cranial nerve is the oculomotor. So its nerve type is motor. So for the function, it contracts eye muscle to control eye movements, interior, lateral, medial, and superior. So it also constricts pupils and elevates eyelids. So for the implication, damages to this nerve in the afferent visual system may cause diplopia, pupil mydriasis, and upper eyelid ptosis. So one of the disorder in this of the third cranial nerve is the oculomotor neuropathy. It causes a sudden diplopia and ptosis with aching pain around or behind the eye. So next is the fourth cranial nerve, which is the trochlear. So its nerve type is motor. So for the function, it contracts one eye muscle to control inferomedial eye movement. So for the implication, damage to this nerve or in the eye muscle can innervate that results in characteristics pattern of diplopia, lost their pupillary constriction to light as well as the elevation of their eyelid. So one of the disorder in trochlear nerve is the trochlear nerve palsy. It causes an ipsilateral higher eye or the hypertropia, and exiclotorsion, which is the affected eye deviates upward and rotates outward. Excuse me. So next is the fifth cranial nerve, which is the trigeminal. So its nerve type is both sensory and motor. So for the sensory function, it carries sensory impulses of pain, touch, and temperature from the face to the brain. So as for the motor function, it influences clenching and lateral jaw movements, which is the biting and chewing. So for the implication, the injury can cause problems with chewing and speaking. So the extent depends on where the nerve damage occurs. So you may have ongoing numbness or facial pain in the area that the nerve serves. So one of the disorder in the trigeminal nerve is the trigeminal neuralgia. Trigeminal neuralgia. So this condition causes painful sensation similar to an electric shock on one side of the face. So next is the sixth cranial nerve, which is the abducens. So its nerve type is motor. So for the function, it controls lateral eye movements. So for the implication, so when there's a damage in the nerve, it affects the lateral rectus muscle, impairing eye abduction, and the affected eye may not be able to move away from the midline normally. So for the disorder, one of the disorder in the abducens nerve is abducens nerve palsy. So it causes an esotropia due to the unopposed action of the antagonistic medial rectus muscle. So next is the seventh cranial nerve, which is the facial nerve. So its nerve type is both sensory and motor. So for the function sensory or the sensory function, it contains sensory fibers for taste on anterior 2/3 of tongue and stimulates secretions from salivary glands, which is the submaxillary and sublingual, and tears from the lacrimal glands. As for the motor function, it supplies the facial muscles and affects the facial expression, which includes the smiling, frowning, and closing the eyes. So for the implication, facial nerve damage can lead to partial or total paralysis of the face and can be upsetting for the person who experiences it. So one of the disorder in the facial nerve is the Bell's palsy. So it is a condition that that causes sudden weakness in the muscle on one side of the face of a person. So the weakness makes half of the face appear to droop. So next is the eighth cranial nerve, which is the vestibulocochlear nerve. So its nerve type is sensory. So one of its function is contains sensory fibers for hearing and balance. So for the implication, the vestibular or vestibulocochlear nerve communicates messages about head position and motion from inner ear to your brain. So when this nerve is damaged, these messages become jumbled and inaccurate, so confusing your brain and producing the dizziness, nausea, and movement issues. So one of the disorder in vestibulocochlear nerve is the hearing loss, tinnitus, which is the ringing in the ears, and also dizziness caused by unsteady balance. So next is the ninth cranial nerve, which is the glossopharyngeal nerve. So in this nerve, it has a nerve type of both sensory and motor. So as for the sensory function, it contains sensory fibers for taste on posterior third of tongue and sensory fibers of the pharynx that result in the gag reflex when stimulated. So as for the motor function, it provides secretory fibers to the parotid salivary glands and also promotes swallowing movements. So for the implication, glossopharyngeal nerve lesions produce difficulty swallowing, impairment of taste over the posterior one-third of the tongue and palate, impaired sensation over the posterior one-third of the tongue and pharynx, and also an absent gag reflex and dysfunction of the parotid gland. So one of the disorder in this cranial nerve is the glossopharyngeal neuralgia. So it is a rare pain syndrome that causes sharp, stabbing pulses of pain in the back of the throat and tongue, and also the tonsils and the middle ear. So next is the 10th cranial nerve, which is the vagus nerve. So its nerve type is both sensory and motor. So for the function, it carries sensation from the throat, larynx, heart, lungs, bronchi, gastrointestinal tract, and also the abdominal viscera. So it promotes swallowing, talking, and production of digestive juices. So as for the implication, the vagal nerves carry signals between your brain, heart, and the digestive system. So they are a key part of your parasympathetic nervous system or the PNS. So vagus nerve damage can lead to gastroparesis, food not moving into your intestines. So some people with vasovagal syncope faint from low blood pressure. So one of the disorder in the vagus cranial nerve is the gastroparesis. So gastroparesis occurs when a damage to a vagus nerve stops the food from moving into your intestines from your stomach. So next is the 11th cranial nerve, which is the accessory. So its nerve type is motor. So its function is it innervates neck muscles, which is the sternocleidomastoid and the trapezius. So it promotes the movement of the shoulders and head rotation. Also, it promotes some movement of the larynx. So its implication is the spinal accessory nerve originates in the brain and enables motion in the trapezius and sternocleidomastoid muscles in the neck. So one of the disorder in accessory nerve is the spinal accessory nerve palsy, which is the SANP. So it is an abnormal shoulder condition that arises following neck dissection, surgery, and can occur with blunt or penetrating trauma to the lateral neck region and cervical stretch injuries. So lastly is the 12th cranial nerve, which is the hypoglossal. So its nerve type is motor. So its function is to innervate tongue muscle that promote the movement of food and talking. So one of its implication is the damage to the hypoglossal nerves causes paralysis of the tongue. Usually one side of the tongue is affected, and when the person sticks out his or her tongue, it deviates or points toward the side that is damaged. So one of the disorder of the hypoglossal nerve is the isolated idiopathic hypoglossal nerve palsy. So it is a condition where it causes paralysis of the tongue. usually one side of the tongue is affected. So that is all for the 12 cranial nerves. Thank you.